Hey everyone, my name is Dr. Galatea Strong. I'm a physical therapist who got 100% on my NPTE, and this led me to found SPT with me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check out our courses at sptwithme.com. Now for what you're actually here for, let's talk about contralateral homonymous hemianopsia. To learn about this topic, you have to know about the visual pathway. So let's talk about it. This image shows a top-down view of the visual pathway. So we have our eyeballs, then we make our way toward the back of the brain, starting with the optic nerves. Then we reach the optic chiasm, and then it turns into what's called the optic tract, which sends information to the LGN, aka the lateral geniculate nucleus. It's in the thalamus. After that, we have optic radiations that send information from the LGN to the primary visual cortex, which is where all the afferent visual information is then processed. This is a purely afferent pathway. Nothing motor is happening at all. What I want you to notice is that each eyeball has two tracks. If we look at the left eyeball, you're going to see that there's a blue line and a red line. Look at the right eyeball, there's a blue line and a red line. You'll see that for both eyeballs, the blue line is on the left side of it, while the red line is on the right side of each respective eyeball. Now look at the left side of each eyeball, or the blue side. Look at what information is received. What's received is visual information from the contralateral side. So the left side of each eyeball is going to receive right-sided visual field information, while the right side of each eyeball is going to receive information about the left visual field. Now we're going to follow the blue and red lines of both eyes to where it becomes the optic nerve, making our way toward the back of the brain. We're going to eventually reach the optic chiasm. This junction looks like an X, and it looks all confusing because there's a lot of crossing over. But really, it's actually not too confusing, so we're going to break it down. So look at the two blue lines starting from our eyes. You're going to see that the two blue lines, even though they were on different eyes, they end up going to the left side of the brain. They both get to the LGN on the left side of the brain. Same idea goes with the red lines, or the right side of each eye. Both red lines make their way to the right side, reaching the right LGN. So when you break it down, you will see that of the total of 4 lines, only 2 of them actually cross over at the optic chiasm. And the 2 that cross over are the ones in the middle, so the right side of the left eye and the left side of the right eye. Just to go over it one more time in a different way, if you look at the left eye and follow the blue line, so left side, left eye, you'll see that this stays on the left side until it reaches the brain. If you look at the right eye and look at the blue line, so the left side of the right eye, this line needs to cross over the optic chiasm to reach the left side of the brain. If you look at the right side of the left eye, you'll see the red line. This crosses over to the right side, reaching the right side of the brain. Right side of the right eye, the red line, does not need to cross over the optic chiasm because it's already on the right side. So blue, aka left side of each eye, stays on the left. Right, aka the right side of each eye, stays on the right side of the brain. Once it reaches the LGN, this is where the information is then sent to the primary visual cortex through what is known as the optic radiations. This is a great image showing you the 3D nature of the optic radiations. There are 2 optic radiations. You see that there's one that curves upward. This is known as the superior optic radiation, while the one that curves downwards is known as the inferior optic radiation, aka the Myers loop. The reason this is important to know is that the superior and inferior radiation have different jobs. The superior optic radiation provides information about the inferior portion of our visual field, while the inferior optic radiation, aka the Myers loop, provides information of the superior field. So far until now, we've only talked about the left and right visual field. However, once we get to this region of the visual pathway, this is where we start to integrate more complexity to our vision, dividing it further into superior and inferior components. Now it's time to get into what contralateral homonymous hemianopsia is. When you look at this image, you'll see that what's happening is that there is damage to the optic tract and/or both optic radiations. On this image, it's labeled as number 4 and number 7. Number 4 is showing that the optic tract and/or the beginning of both optic radiations is affected. Number 7 is showing the end of both optic radiations being affected. Now understand that anywhere along the optic tracts, if there is damage to both of them, it will result in the presentation of contralateral homonymous hemianopsia. So let's break it down. By the time that we get to either the optic tract or the optic radiations, the information at these locations are just coming from the right side of each respective eye. If you look at this image, it's only damage to the right side of it, okay? That's why it's to the right side of each respective eye. As you can see in the image, once we've crossed the optic chiasm on the right side of the brain, it's only information from the red line, suggesting the information received on the right side of each eye. Well, what information is being received? It's going to be contralateral to the side that is affected. So the left visual field is affected. The blue lines, or the left side of each side, is not affected at all. So let's take a look at this schematic of how a patient would essentially see the world in their own point of view if they have contralateral homonymous hemianopsia. The pink suggests that it's a blind spot, so you cannot see anything. The white suggests that you can actually see something. So this is exactly how a person would present. A person would not be able to see the left field of view of either eye, and this is because the right side of the eyes, which receives contralateral information once again of the left field of vision, is damaged. So if you're having your patient do a visual field test, you're going to expect them to be able to see everything that's on the right side of their view, but they would not be able to react to anything in the left field of view because they cannot see it. Keep in mind that this example is on the right side of the image, okay? If it were on the left side of this image in the same area, it would present as the absolute same, however, in the opposite direction. If you enjoy material being taught this way and you're studying for the NPTE, check out our courses at sptwithme.com. Take a look at these references for more information.